Hi guys, welcome back to my channel. My name is Amaka. If you're a new subscriber, welcome. And if you're an OG, if you're a returning subscriber, you're my bestie already. And I'm so glad to have you back here. Right, this video is going to be quite different. You know, I'm going to be gisting or yeah, it's not going to be a serious YouTube video. So I'm going to be gisting you all the things that I experience and I never knew about until I experienced them. Okay, so some things that happened to me while I was pregnant and even post pregnancy, and I feel like they are not talked about enough. So in this video, I'll just be discussing a couple of them. First and foremost, vomiting, which is also called morning sickness. Guys, I was told that you just have morning sickness within 3 months, like the first trimester, and after first trimester you're good to go. I was really looking forward to that because after first trimester, during first trimester rather, I was throwing up a lot. I lost weight. I was just hopeful that, oh, okay, let me just endure. When I'm done with this phase, with this first trimester, everything will go smoothly from then. I was just deceiving myself because, yeah, after first trimester, it reduced. But as I got to 25 weeks, I started throwing up again. And I was throwing up till I gave birth. I was throwing up during contractions. It wasn't funny. It wasn't funny. The doctor prescribed the drug for me. It's called Avomine. Yeah, Avomine. Apparently, the drug is supposed to reduce the nauseous feeling, but it didn't work. I think they said I should take it 30 minutes before I eat or something, but I tried everything. Nothing was working. I kept vomiting. I vomited every other day. This is after first trimester. I kept throwing up every day. It wasn't funny. Then I complained to my mother-in-law, and she was like, "Oh, that I should take ginger. I should make sure I eat ginger whenever I feel like throwing up. That is going to stop the whole thing." I tried ginger. At first, it was looking like as if it wanted to work, but trust it to come back. It came back. I was still throwing up, though it kind of helped a bit, but it didn't completely eradicate the anxious feeling. Like it was so bad that I had to start selecting food to know that okay, if I eat so and so, I'll throw up. If I perceive so and so, I'll throw up. So I had to study my body. It was like studying for a course. I had to study my body to know what I can eat and the things I shouldn't eat that will trigger, feeling nauseous and all. It was not a sweet experience. You know all those weird cravings that pregnant women have? I didn't have them, but I still had to select my food. There was a particular food I know that if I eat, it is less likely for me to throw up. So if you if you're pregnant or if you are yet to be pregnant and you see that after the first trimester you're still throwing up, please just know that it's completely normal because I had to read up. I saw that for some women, the anxious feeling doesn't completely go. For some, it lingers to the end of the pregnancy, like it did for me. Mine lingered till I was about to push. It was that bad. So not be scared, you know, at least for what is worth it. This one was not the most annoying, but one of the most annoying. I had migraine. I think from the beginning, so let me say, to when I got to 8 months, 8 to 9 months, I kept having severe migraine. One side of my head would be banging. It was crazy. I took drugs. I took painkillers. At some point, I was scared that, oh, all these drugs I'm taking, I hope it will not affect my BP because it was getting too much. It didn't have anything to do with my BP. My BP was normal from the beginning of my pregnancy to the end. My BP was regulated. It was very normal. Where the migraine was coming from, I couldn't tell. I was taking my anti-malaria drugs constantly, but migraine kept coming back. Ah, it wasn't funny. at all. Now, this one was, yeah, the most annoying. I kept having serious muscle pull. This was how it was. If I wake up from sleep in the morning, I dare not stretch. You know how you wake up and you just want to stretch your leg, stretch your back? I couldn't try it. Sometimes it comes subconsciously. You know how you wake up and stretch subconsciously? Like if I just do that mistake, I will, as it will grip my leg. Oh, it was painful. I will shout. My husband will always wake up. Baby, what's the problem? What's the problem? What's the problem? I'm like, "Babe, my leg, go, my leg. It was all funny. God. It was constant. I kept having muscle pull. I kept having muscle pull. I didn't know why I was having muscle pull. It was I was wondering why am I having muscle pull because I'm pregnant. I, I said it was just a puzzle I couldn't solve. So if you're having muscle pull, trust me, babe, it's normal. Don't be scared. It's normal to have muscle pull. Because I told my doctor, he said, sometimes it shouldn't be normal, please. But I had muscle pull. It was not a good experience. That the muscle pull itself wasn't a good experience. This particular one is very normal, but I find it abnormal at the same time. I was always sweating profusely. I was sweating like a Christmas goat. If there's anything like that, if there's anything like Christmas goods, I was a perfect example that period. Even when the AC was on, it's like it was in number 16. I think number 16 is usually the highest, you know. I'll be feeling hot. Sometimes I'll be cold and I'll also be sweating. It wasn't normal. Like I'll be sweating and I'll be cold at the same time. So if I cover my body, I'll feel hot. If I leave my body, I'll keep sweating. Sweat was over the roof. The sweat was too much. I sweated a whole lot. See, if they could bring buckets, it could fill the bucket. It sounds like I'm exaggerating, but in the real sense, that was how it was, honestly. This particular one was really bad. It was really bad because till now I'm still experiencing it. I was getting very forgetful. It was too bad that if I think of doing something now, I can forget it the next second. It was bad because even at work, it was affecting me. They will ask me to do something. I will leave my boss's office to my office and I'll forget. It was so funny. Like I'll forget, I will completely forget. He will not ask, oh, Amaka, have you done this thing I have to do? I'll just be moping. It will be sounding like they're speaking Chinese. I became very forgetful. Even till now, I'm usually forgetful, but pregnancy made it worse. It was so bad. I have to write the tiniest detail on my notepad, no matter how small the tax was. As small as, oh, when I get home, I should remove the soup from the fridge. Just all those very small details that you're supposed to like remember, on a norm, like you shouldn't even write down. I had to write them down because I knew that if I don't write it down, I was gonna forget. If you check my notepad in my phone when I was pregnant, you would think that this person does not know what she's doing. Like she she doesn't have a brain that stores things. It was that bad. It's also called mommy brain. Yeah, that's the general word for it. Mommy brain is real. I encountered it. I saw it live and direct. It's real. So sis, if you're forgetting to flush the toilet or remove the soup from the freezer or do something that on a normal day you cannot forget, it's normal. Please don't feel bad, don't get worked up, just be hopeful, just try and probably write them down. I don't know, because there's some things sef that is weird writing down, but I think the only way that you can help yourself is to write them down. That's the only way you can help yourself. Just try. If you know that you want to perform a task the next minute, try and write it down so that you don't forget. Okay, what's the matter? Hmm? What's the matter? So you're deceiving me. See, show them that you were deceiving me. See, this is 2 a.m. in the morning. This is the only time I have to do this video. What is it? But you've eaten. Oh, yeah, take. You want to do video with me, Abi? Oh, yeah. Say your name. Introduce yourself. Introduce yourself. Collect. Introduce yourself. Ah, you don't want to talk, but you want to do YouTube video. So, guys, I had promised that I was going to introduce him in my next video, but I wanted to do it specially. But as he has forced himself to come for introduction, I present to you Nyena Bong Kamsuyo Chukwu Epo. This is my baby. This is the cutest baby in the world, by the way. We will say hi to the camera. Yeah, yeah. Hi, guys. Hi, guys, right? Say, welcome back to Mommy's YouTube channel. Yeah. See, you have to let me, if you want to stay with me, you have to let me concentrate, okay? Yeah, so this one is quite funny. You know when they say when you're pregnant, you feel the sex drive more, you're always horny, you want to have sex. Huh. I don't know if that's how it was for other people, but for me, it was not like that though. I didn't want any foreign objects in my body. I don't know if I would say I was just irritated. The only reason why I would allow sex is because they said it was going to induce labor towards the end of my pregnancy, it was going to induce labor. Even at that, it didn't induce anything because I still had to get induced. So intimacy when I was pregnant was a no-no. I was not just feeling it. So I think maybe the first around second trimester, it was still fine, it was still normal, but towards the end, I was just, when you're just tired, you don't want anybody coming close to you. I was just irritated. Everything was irritating me. Like you don't want to bring foreign objects inside my body. Nah, how far? Ha. I don't know about other people. Maybe for them their sex drive was more, their libido was high, they were all about sex. For me, nah, 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 nah. I didn't want it. I didn't want it at all. This one was crazy. To get the perfect sleeping position when you're pregnant is a sport. It was like a serious chore, like a household chore. It was a real sport. Because they say, oh, don't sleep on the back. If you sleep on the back, I think blood will not pass to the baby's brain. The baby will have issues. See, but yeah, okay. I slept on my back. But you turned out just fine. You turned out just fine. Even as I slept on my back. Eh? I don't know. Maybe I was just lucky. But the perfect sleeping position for me was to eh, relax. So, as in was to there's a way I sleep. I will rest my back, but I'll raise one leg up and tilt to the side. I don't know how to explain if I'm not lying down, but just imagine me lying on my back and raising a leg up and tilting to the side so that I'll be in the middle. I will not just entirely turn to the side. At least I'll be between laying on my back and being on the side. That was the perfect position for me. I couldn't stay on one side. I think they said, is it the left side or be the right side is the best position. How long do you want to sleep on a particular side? That place will pain you. I was just trying to obey. That feeling when I heard it, I was so scared. I was trying to obey. I was sorry, baby. I was resting on that side. Particular hand was in severe pain. And they say don't lie on the other one. No, how at some point I started praying. When I've slept on my back for a while, I'll start praying, God, please let my baby not be abnormal. Let my baby not be abnormal. It was so funny. I was praying. But see, my baby turned out fine and he's smiling. But then my baby turned out perfect. And I slept on my back. Oh. I'm not advising you to sleep on your back. I'm not a medical practitioner. Yes, yes. Oh, you won't support me, Abby? Eh? Hmm. Oh, really? Ah, I know. You're enjoying it as I was sleeping on my back. You're enjoying it. Oh. I didn't know you were enjoying it too. So you enjoyed it. I trust you, my love. And hey, as I was saying, I slept on my back. I'm not a medical practitioner, right? I'm not in the best position to give you an advice on the um position to sleep. Our bodies made are built differently, and maybe I was lucky, you know, that even as I slept on my back for a good number of time, my baby turned out fine. Nothing happened to him, as you can see. Yeah, so that one was a hurdle. That sleeping position was not funny. This particular one broke my heart, guys. I lost a lot of hair. My front hair. I would have loved to show you, but I'm on a wig. I lost hair. I lost a lot of hair. My front hair was. Sweetheart, are you ready to sleep? My front hair was bowed. It was not funny. I think I'll put a picture of how it was. I pray I still have the picture. I lost my front hair. It was bad. I was just so lucky because I'm on low cut, so it's not really bad, and I'm very hairy. I have good hair. That's why my baby has fine hair. Yeah, that's by the way. So I think maybe it didn't really show because number one, I had hair and I'm on low cut, so but it was so bad, it was so obvious that I lost there. Are you ready to sleep? Now, this one again, stretch marks. So that your skin will never remain the same. Stretch marks showed me shiggy. I had stretch marks in my tummy. I had stretch marks at the back of my thigh. I had stretch marks at the back of my knee. Yeah. I had stretch marks. Where did I have stretch marks? um yeah, I just had like serious stretching, but now it's fading gradually. It's not as bad as it was when I was pregnant or when I just put to bed. But if you're seeing stretch marks in weird places, don't be scared. It's normal. Another thing I experienced was pelvic pain. I experienced pelvic pain from, I think, when I was 3 months till I gave birth. I was having pelvic pain. My pelvic was on fire. When I say pelvic pain, my like my waist region was on fire. I was having severe pelvic pain. So if you're having pelvic pain, it's normal. There was no way I could ease the pain. I tried to twist my waist. The pain was still there. I tried to even crack it. I was scared I don't hurt my baby. I was telling my husband, baby, hit it hard, hit my waist, hit my waist. My husband would literally use his fist to, try to, I, and because he was scared. I was just in pain. I just needed to ease my pain. I'll tell him, baby, hit this waist. You're not hitting this waist. Hit this waist. You say, baby, you're pregnant. I don't want to put too much force so that I don't hurt you or the baby. You know, I had serious pelvic pain and lingered till I gave birth. So if you're having pelvic pain, please be rest assured that it's normal and it comes with the whole pregnancy thing. Now, this particular one is the one that I didn't understand why it happened to me. I didn't understand what it was. I had to read up. This was after I gave birth to my baby. I started having pain. Trying to look for the best way to describe the area I was having the pain. It's called tailbone pain. I was having it like around. It's not inside. It's not my inwards, but the bone that is holding my inwards. I don't know how to explain it, but that place was paining me. I was in serious pain. It was painful. I couldn't walk well. The first 5 weeks, I was experiencing the pain. I was not saying, is it from the stitch? Because I had a tear, so they had to stitch me. I was like, is it from the stitches? Is there a vein that a nerve that they went to stitch? I couldn't place why that pain was there. Because now when I read up, and I think my sister-in-law even said that that's tailbone. She was the one that even told me the name, that it's called tailbone pain. So as she told me the name, I had to go check Google, and the same area, the same way I was feeling was what they described. That's when I knew that I knew what was happening to me. But are you feeling sleepy? This particular one was what I didn't like at all. I had hemorrhoids. When you're trying to pull, and it's like the skin in your anus comes outside. Please, I'm sorry if this sounds irritating to you, but I'm just trying to explain it in the best way so that you can understand what I'm saying. So it was like a skin tag. It was just out. It was out for like, say, 3 to 4 weeks before it went in back. Now it has gone in. It has gone in. I'm getting better. I don't experience pain anymore trying to use the toilet. I'm getting better. But if peradventure you experience that, please know that it happens. It's not strange. I'm just, feeling bad that it's not discussed enough. It's not talked about enough. So many things that happens to people are not, discussed, especially during antenatal. Those, sweetheart, those possible things that you might experience are supposed to be discussed during antenatal, but it's just the basic thing they tell you. Oh, you had the pregnancy is breastfeeding, blah blah blah. Do these ones, these post effects of pregnancy, they don't discuss it enough. I was having shortness of breath. It was not funny. I was feeling like my chest was getting tight. It was tightening. I feel like these things are not discussed enough. I feel like they need to talk more about it, because it's just the basic. There are so many things that are less discussed and it's not nice. Please, I want to use this opportunity to give flowers to every mother out there. If you've experienced childbirth, whether through vaginal delivery, whether through cesarean section, you're a hero without a cape, and I adore you. You are priceless. You are perfect. Women go through a lot. Women go through a lot. So if there are some I didn't mention, please kindly write it down in the comment section. These ones I explained and I talked about was my own personal experience. So if you had an experience I didn't mention, please let's discuss that in the comment section so that everybody can learn as well. So we've come to the end of this video and I hope you enjoyed this video. So if you did enjoy this video or you learned a thing or two, please do give this video a big thumbs up, like, share, and comment. Also hit that subscription button down below. Don't forget. So until my next one, bye.